Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have a patient who attended with bilateral occluding ears. It's a combination of earwax and dead skin. This is their right ear. We're just going to commence with their left ear, which is the worst ear out of the two. Just to provide you with a brief case history, this patient suffers from chronic ceruminosis. Ceruminosis is a medical term, if you like, for buildup of earwax and also dead skin. Historically, they've had their ears cleaned using water irrigation. However, that's led to the patient developing otitis externa, also known as swimmer's ear. Therefore, around 4 or 5 years ago, they decided to have their ears microsuction, but unfortunately, they found the whole procedure extremely uncomfortable. To the point where the patient then decided not to have any further treatment with their ears and to see if they can just manage and cope with this build-up. However, a few days ago, the impaction got so bad that the patient went to see their GP because they were experiencing not only ear symptoms, so almost a complete loss of hearing, tinnitus, vertigo, you name it, this patient has experienced it, but they were also suffering from a really bad headache. The GP examined the ear and advised the patient to have this earwax removed because this could be the root cause of all their problems. So the patient did some research online, came across my YouTube channel. They were also recommended to visit me by a friend of theirs who had previously attended. So when the patient attended, they explained their predicament, their concerns, and I reassured the patient that we're going to be as gentle as possible. And you may have seen the name of the video is aptly named The Operation Game for earwax removal because of the bad experiences this patient's had. And it's not just this patient. The aim is to do this with all patients. I just did not want to cause any trauma to this patient's ear canal. I did not want to even come in contact with the bony part of the ear canal with this patient because the last time they had microsuction performed elsewhere, they found it so painful. And I don't want to give this patient any reason not to have their ears cleaned out in future because unfortunately it appears as though they're going to have this done on a regular basis. So I was extremely careful, like we always are. So we're not making any further exceptions. It's not like I'm not careful normally, but with this particular case, I had reassured the patient, and throughout the procedure, I was just asking them how they were, how they were feeling, and thankfully the patient was really happy with the treatment provided. Now, when we're on the outer third of the ear canal, the cartilaginous portion, we can put a bit of pressure on the ear canal. That's fine. That's made up of cartilage. It's not rigid like the inner 2/3 of the ear canal, which is made up of bone. So this region where we're working on now, we just had to be so careful. Unfortunately, we weren't able to use any other instrumentation other than suction because if we used a Jobson horn, for example, we would have made contact with the canal wall. It would have been uncomfortable for the patient. And also, this impaction was on their eardrum, and we can't go onto the eardrum using a Jobson horn because again that would be really uncomfortable. So we continued with microsuction. The consistency, as you can see, it's like soft butter. So I've had to use loads of different types of drops. I've used a combination of olive oil spray. I also used sodium bicarbonate drops, and I'll explain why I used that in this particular case. Even with the use of the drops, it was so difficult to suction this. Now, we've cleared the majority of the ear canal and we're now just very medially working. So when we say medial, we mean towards the eardrum. And we're just trying to find the eardrum. When you've got a consistency of wax and keratin like this, I just don't know how thick this layer is. Therefore, if I over-insert the suction probe, I run the risk of making contact with the eardrum or where I am now against the ear canal. So we have to be really tentative. We have to be play it cautious. We don't want to overexert and the suction probe to come in contact with any part of the ear because that would be really uncomfortable. Now, just to make you aware, I don't remove every last speck. It's just not possible with this type of wax. It's probably a procedure historically I wouldn't have uploaded on social media because I would have feared the backlash I would have got from a few viewers. But now that the comments are disabled, I'm more happy to upload these because these are actually the more complex procedures. These are, I would say this is the most complicated case I've done so far this year. And I have done quite a few complicated cases if you've been watching and following me on social media the last few weeks in particular. Now, this patient's ear canal is also slightly stenotic, so narrowing as we approach the eardrum, which again makes it much more difficult. Ideally, you like to use a fine end suction probe. Fine end is a lot narrower than the standard Zollner suction probe, so we can get into the narrow part of the ear. It's also less noisy as well, and it's less traumatic. So in the worst case scenario, if we do come in contact with the ear canal, it's not going to be traumatic, or should be less traumatic than, for example, the Zollner suction probe. And throughout this procedure, I was just thinking about that game, the operation game, where you want to avoid making contact with the sides of the body, where you're trying to remove different parts using tweezers. Now, I'm just approaching the eardrum. I don't quite know where this eardrum is yet. I can see a slight blue tinge just below the suction probe. So I know I'm nearing the eardrum, but again, I'm just approaching it very tentatively, almost kissing the surface. I use different types of drops in this case. I would normally, my preference is olive oil spray, medical grade. Now, olive oil doesn't break up wax. It's not what it's designed to do. Olive oil helps to soften the wax. It lubricates the canal wall. It also lubricates the inside of the suction probe. So it helps to limit blockages. But with olive oil in this type of consistency, it wasn't really doing much. So I instead reverted to sodium bicarbonate drops. Now, sodium bicarbonate drops is water-based, and sodium bicarbonate drops is known, alongside hydrogen peroxide drops, to, I wouldn't say dissolve the wax, because sometimes when you use to dissolve, you can assume that it disappears, but it breaks up the wax. And sodium bicarbonate drops does that slightly different to hydrogen peroxide drops. So sodium bicarbonate drops, because it's water-based, the skins, so earwax, and it contains dead skin cells, and these dead skin cells are what we call hydrophilic. They like to absorb water. So because sodium bicarbonate drops contains water, the skin cells is attracted by the water, and the skin cells overhydrate. And when they overhydrate, they burst, they fragment, they break down, which can help me then remove some of this. But it's still within the ear. That's the issue. The wax doesn't disappear, and that's why I'm a bit tentative to use that phrase. So the drops don't dissolve earwax, but they help to break it up. Now, we'll just come back to that in a moment. I'll explain how hydrogen peroxide drops work in a moment. It's similar, but it also has an additional property. So the reason I want to come back to it is in a moment, you're going to see this patient's eardrum, and I'm having no choice but to use the full Zollner suction probe here, because although the ear is very narrow and we're up against the eardrum, the Zollner's, the fine end just wasn't powerful enough. And in a minute, there we are, and I'm going to pause that, and you can see the eardrum. At that particular moment during the procedure, the patient instantly could hear significantly better. They were quite emotional, actually, because they've forgotten how it is to hear. And I think unless you suffer from earwax impaction yourself, and myself included, you can never really truly appreciate how debilitating it can be. Of course, I've got a fair understanding and idea because I treat patients each and every day, and I can see from their reaction and feedback. I've had an ear infection before as well, which also caused really severe earache and reduced hearing and tinnitus. So I have got a fair idea, but fortunately, it resolved very quickly. So I'll just discuss how hydrogen peroxide, your eardrops work. So they too are water-based. So the hydrogen peroxide itself, similarly, because it's immersed in water, they get absorbed by the skin cells, which form majority of the wax plug. And in this patient, they've also got a lot of dead skin. So it's not just earwax. This dead skin has become macerated. It's dead skin that's shedded. It hasn't left the ear canal. And because of the humidity, moisture, or it could be that the patient's got water in their ear as well, the dead skin has absorbed the water and become macerated. It's softened, become mushy, and it's burst. So hydrogen peroxide drops, similar to sodium bicarbonate drops, the solution, the water-based solution, gets absorbed by the skin cells. The skin cells then hydrate, they swell, they burst, or they fragment. So it helps to break up earwax. Hydrogen peroxide drops also, when they come in contact with moisture in the ear, they release oxygen, and that oxygen bubbles. I'm going to try and pronounce the word. My pronunciation isn't always the best, but effervescence. I think I pronounced that correctly. I apologize if I didn't. And the effervescence caused by the release of oxygen, so a foaming, a bubbling action. That's why a lot of people that use hydrogen peroxide drops report that there is a foaming. They can hear the crackling. That mechanical foaming also helps to break up earwax, but it doesn't dissolve it because it's still in the ear, as you can see. So I've used a lot of sodium bicarbonate drops in here. I haven't used hydrogen peroxide drops, sorry. It's not a drops that I like to use myself because that can further make this impaction mushy. It's one of the things the issues I've got with hydrogen peroxide drops. Yes, it breaks up wax, the science is there. As I mentioned, it's got two ways of doing it. It's like a dual function. Not only does the water solution get absorbed by the skin cells and rupture and break up, but it also releases this chemical reaction where oxygen, you get effervescence of that. I'm trying to say that word as much as possible. And also, so another word for that is foaming. It foams up and it breaks up the wax. So it has got the scientific background and principles behind it. But I don't like the consistency it makes it too. And a part of me thinks this patient may have used hydrogen peroxide drops because of the consistency. So you can see there's a few hairs here as well, which can make it a bit more difficult to suction, because when you've got matted hairs, you get less of a suction grip. This shouldn't be this deep in the ear. So I did question the patient if they've used cotton buds, which they said no, which is great. But they do trim their ear hairs. So I've asked them to place some cotton wool at the entrance. Now, guys, I think we're almost finished there, but I can see the eardrum, the outline. There is debris there. I wish I can get every little last speck out. Unfortunately, I can't. By attempting to do so, I'm just going to cause unnecessary trauma to this patient's ear. It's not really going to improve their symptoms any further. They can hear so much better. In fact, the best they've ever heard. They said, I'm quoting the patient here, or at least for the last 10, 15 years, I think they said. And the whole experience for them was so reassuring. They are now going to come back on a regular basis. I have given the patient some tips to avoid water in the ear. Now, because we've used some water-based drops like sodium bicarbonate drops today, because it's water-based, water can lead to an infection. It can lead to otitis externa, also known as a swimmer's ear. And I'll explain how water does that, actually. So whilst I talk about that, you'll just continue watching me. I think I'm just going to see if I can get a bit more around the edge, but I don't think I achieve any more, if truth be told. So what water can do? Water can do two things, actually. It can cause maceration of the skin. So prolonged exposure to water can cause maceration. So the water gets absorbed by the skin cells, the outer layer of skin cells, because they do actually like water. They're hydrophilic. They then burst, they overhydrate, basically, and they overswell, they burst. And when they burst, they become soft, they wilt, the skin will become wrinkly. I think we've all probably experienced that. So if you've got a plaster, a sticky plaster around your finger, if you've cut or bruised any parts of the body, because of the humidity caused by the plaster, that skin becomes really soft and mushy. Now, in case of the ear, when you've got soft, mushy skin, obviously that can cause a blockage. But because that outer layer of skin, that protective barrier, the epidermis layer, made up of epithelial skin cells, because that's been compromised, it then allows opportunist bacteria and fungi to invade the surface of the ear canal and start reproducing, which can then lead to an infection. And this, maceration of skin, it can sometimes not only be superficial, it may not always affect the outer layer of skin, but it can also affect the inner dermis layer. So prolonged exposure to water is bad for you. Even getting water in your, as generally speaking, so for when you go swimming contains harmful halogens, which can then start to wash away and break away a protective film that we have in our ears. So the hair follicles, these hair strands that you're seeing now, at the root, there's you've got attached a sebaceous gland. The sebaceous glands secrete this oily, fatty substance called sebum. It's also found in our scalp, and this secretion provides the ear canal with a protective film. It's almost like a fatty, greasy layer of oil, which is not only a moisturizer, but it's also acidic, and the acidity helps to fight away harmful bacteria and fungi. And it also can provide a bit of a physical barrier as well, this thin coating, this film. But when you've got harmful chemicals in you, the chemicals can break down this protective layer. I should also add there's another type of gland, ceruminous glands, which secrete an oily sweat. That too to provide a protective barrier that forms with sebum and dead skin to eventually form earwax, actually. And also, if you're in the shower, especially if it's more hotter water, this hot water can wash away this protective barrier. And when you wash away this protective barrier, again, you're pre-exposing the ear canal to be invaded by harmful bacteria and fungi. So it's really, really important to avoid water. And you may have noticed sometimes water, I get it quite a bit as well, not on my ears, I'm very careful, but on some parts of my head and face. Water, after a shower, I get really dry skin. I was always trying to figure out how's that possible? What's the science behind it? So the reason for that is this lipid layer, this secretion that we've talked about that lines the ear canal. Not only does it prevent external harmful bacteria and fungi to penetrate the deeper layer of skin and then cause an infection, but it helps to retain moisture within inside the skin and the ear canal. When that protective film of oils and grease and fatty substances is washed away, it can't regulate the moisture, it can't control the moisture level within inside the skin cells underneath. So it's skin, water contained in the skin can then evaporate. It can disperse outwards, out of the ear canal, and get evaporated. So, which then dries up the ear. So these oils are really, really important. It helps to maintain fluid, moisture within the skin cells. And if that protective barrier is compromised, fluid in the cells, water that's inside the skin cells, then permeate outwards and they evaporate, which then leads to dry skin. And that's all down to water. If you're washing your ears out with warm water in particular. So even short exposure to water, like I've just described, can cause a dry ear, and prolonged exposure to water can lead to maceration of the skin. So you can see water is not good. Water also increases the pH level in the ear because it washes away the acidity, and when it washes the acidity away, the pH level of the ear increases, and we want the ear to be slightly acidic because the acidic nature of the ear, again, it helps to fight away harmful bacteria and fungi. So if ever you get water in your ear, there's a couple of things you can do. You can use 1 part rubbing alcohol and 1 part white vinegar and put that in your ear. And that recipe has been well documented by various ENT. And the way that particular solution works is, I'll briefly explain. Alcohol binds to water molecules and it then forms one single solution. And as you know, alcohol has a quicker evaporation rate. So when you're rubbing alcohol on your hands become very, very dry very, very quickly. And that's because the alcohol evaporates. So what alcohol does, rubbing alcohol in the ear, absorbs excess water, binds to the alcohol then evaporates and the ear becomes dry. And the white vinegar provides some acetic acid, it reacidifies the ear. You can see on screen, you can also try this clear relief drops that we actually sell on our website. So the clear ear relief drops, it contains an ingredient called glycerol, And glycerol acts very similar to alcohol in that it absorbs water. It's hydrophilic. So if you have got any excess water that's retained in the ear canal, or indeed if you've got some swelling of the ear canal, some edema, that fluid trapped in the cells gets absorbed by the glycerol. And glycerol is also very good in the sense where rubbing alcohol may be slightly guilty of. Rubbing alcohol has the potential to over dry the ear, whereas glycerol, it is quite greasy in nature, so not only does it absorb excess water, but it also helps to moisturize the skin. It's almost like a fatty substance, a greasy substance. So in that sense, it's better preventing over dehydration of skin and water absorption. So therefore, your ears are less likely to become itchy, I would say. In addition, Clear, the relief drops, contains a topical anaesthetic, lidocaine. So if you have got some discomfort in the ear, the lidocaine can give you some short, temporary relief, some hence the name of the drop, some numbness in there. I'm also going to just leave with you a review left by this patient, so you can view that. Do take care, guys. Keep watching. I really appreciate all your support, and we shall speak soon. Bye.